I'm Dr. Julius Gardin from Hackensack University Medical Center and a professor of medicine at Rutgers, New Jersey Medical School. And I'm delighted to be here at Boston at the 21st World Congress on Heart Disease and the 2016 annual scientific session of the International Academy of Cardiology. And I spoke today about the role of echocardiography in epidemiologic studies and clinical trials, sort of a 40-year overview. And really, the history of this begins with the use of M-mode echocardiography to measure left ventricular mass using the model of a prolate ellipsoid for the left ventricle. And this was very useful along with an estimate of left ventricular fractional shortening and ejection fraction in early trials of hypertensive agents, things like the VA cooperative studies and TOMES and LIFE. And some of these studies reveal to us that most of these agents, beta blockers, ACE inhibitors, diuretics, were successful in reducing left ventricular mass. And that in, for example, the LIFE study, we found that, that the change in left ventricular mass, or lower on-treatment LV mass, was more predictive of events than what actually happened to the blood pressure. Now, concomitant with this, there were a number of large epidemiologic studies that also used echocardiography, notably the Framingham study, but also studies such as CARDIA and the cardiovascular health study. And Framingham showed us that left ventricular mass was very much a predictor of cardiovascular events. The coronary artery risk development in young adult study, or CARDIA, actually showed us that if you were a young adult, say ages 23 to 35, and you had decreased systolic function, your risk of developing heart failure within the next 10 years was 37 times that if you didn't. So this was a very important finding, and I think probably affected now how we classify heart failure. Now we have a class A, which is really pre-development of heart failure. The use of echocardiography in valvular disease has also been very robust, not only to evaluate prosthetic valves, which is a major industry, but also, for example, in studies of diet drugs, where we were involved in a major study that showed that folks who were on fen-phen or dexfenfluramine had a higher prevalence of mild valvular disease, notably aortic regurgitation, especially if they'd taken it for 3 months or more. But after a year being off it, most of them either didn't get any worse or got better. Echo has been very useful in the evaluation of coronary heart disease and heart failure. It's been used for things like interventional trials, for example, the Stitch surgical interventional trial. It's been used in terms of evaluating chest pain. For example, a very recent study called PROMISE compared stress echo and nuclear stress imaging versus CT scanning, and showed that really either a stress imaging or stress echo compared to CT angiograms showed no difference in terms of 42-month follow-up in detecting various cardiovascular events. Now, the use of carotid imaging has also been very interesting. We know that it has shown that various antihypertensive drugs and lipid-lowering agents have demonstrated decreases in carotid IMT. But a cautionary tale is the story of niacin, or extended-release niacin, where we know that it lowers LDL and increases HDL. We know that it decreases carotid IMT. But in the AIM-HIGH study, which was stopped early, it did not decrease overall cardiovascular events. So we know that when we're imaging, say, the carotids and things like LV mass by echo, these are subclinical disease, but they're not hard endpoints. So we always have to keep that in mind. Now, newer applications of ultrasound include 3D echo, which has been very important in some of the structural heart disease interventional trials, including the MitraClip, but also the use of strain imaging has been very important. And it's particularly important when we want to look at early manifestations of myocardial disease, for example, in cancer, where anthracycline, for example, has been shown to decrease the global longitudinal strain. And this is just one of many examples. I think future studies will include more handheld ultrasound. We were just involved in something through the American Society of Echo, where they studied patients in a remote portion of India, and the studies were sent by cloud to readers in the United States, and was both an epidemiologic study, but also something that was, I think, a wonderful charitable use of our resources. So I think it's been a very interesting first 40 years for ECHO in terms of clinical trials and epidemiologic studies, and looking forward to the next 40 years.